My name is Trudy Norman, and I'm a doctoral candidate. I'm a CARD-C, I'm interdisciplinary candidate in nursing and anthropology, and my specialty area is homelessness. And one of my dissertation work, this is not my dissertation work, is actually on activism and resistance by people with experience of homelessness. But I also have a real interest in social exclusion and inclusion. And this is my colleague, Hilary Marks. And Hilary is a community researcher and is a person with experience of homelessness who was a key part of this research project. Taking a leap of faith and meaningful participation of people with experiences of homelessness. So part of this, the context in which this sits, is the Greater Victoria Coalition to End Homelessness, who is one of the sponsors of this work, is currently in the process of updating the 10-year plan to end homelessness. And one of the things that they've always had as a key aspect of the coalition's work is a willingness and an interest in including people with experience of homelessness in the work of the coalition. They've tried to do that in several different ways since 2008 when the coalition was started, but they haven't really worked out, and haven't been really sure why that's been. So couple that with a current move toward different areas of actually having people who experience that issue be included in the work, and that's being seen as being really important. Which no kidding.
No kidding.
Yeah, no kidding. Wow. So there's a lot of work being done in mental health, in the mental health consumers movement. A lot of work also been done in the HIV/AIDS movement, where consumers is one group people have been included and taken part in the work. Oh, thank you so much. So the coalition was begun in 2008, as I said, and they are now working to update their plan. They want to include your participation is needed, people with experience in the work. But how to do that meaningfully, and what we mean by meaningfully is that people with experience of homelessness actually take part in decisions that affect them, but in a way that means something to them, right? When?
It's okay if I say it, or you just want to do your thing?
And then we'll have some questions.
Okay.
I think we'll maybe go to 1 o'clock and leave about 15 minutes for questions, but absolutely I want to hear your questions. So how to participate and adding people's voice to that update. So the first phase of this research, it was actually a literature review. And out of the review came, our main finding was that social exclusion, which is experienced by people who are homeless, is based on, is rooted in unequal power relations. And what we call the power is influence, right? The ability to get what you want and to have your needs met. Often that involves money, but it's also being able to take part and have your voice heard. Right? And what we came from that is that in order for people to participate, what the literature had told us at that point was that people needed to have stipends. They needed to be acknowledged and valued. They needed to have food. They needed to have bus tickets and have childcare. Because without those things, it's really not possible for people with experience of homelessness to participate. Because when our sessions held, when you receive that, right, is that they're often held during the working day. Most people work 9 to 5, Monday to Friday. So they're held at those times where people who are homeless are wanting to come, but they might miss a meal. They might miss a bed for the night if they do take part. So they make those choices. So in order to make it more equal, more equity in that participation, then we provide the support so that people can take part. So after that piece, we go, what we wanted to know was, what does that participation actually mean? This is what the literature had told us, but what does participation meaningful for people with experience? How do they want to take part, and what actually would that look like, and what do they think about what might be useful to do? So, phase 1, social exclusion, power, addressing power, and few strategies to exist to actually do that. So, this, taking a leap of faith, was the views and opinions of people with experiences on what could foster their participation in developing solutions to homelessness and contribute to the coalition's knowledge base. Because what the coalition actually wants to do is develop a policy that actually embeds participation in the work of the coalition. Right? So they need to have the views of people with experience. If you have any moment here to say, you can jump in. So one of our participants, I remember very clearly the day that this fellow said this, the homeless, to voice our opinions. And without doing that, no one would ever hear an act. And if you're able, maybe some won't be here, but without it, aren't we off to? So what do? We use focus group methodology. We had 7 focus groups over December 2012 and January 2013, and a total of 63 participants, a community researcher. Would you like to tell us a bit about how we got you?
So I'm experiential in homelessness, and I'm out there in the community, and I'm now going to school to get my social work degree. And so while I'm doing this, I'm still in contact with the agencies around town, and somehow heard that there is a job available looking for a research assistant for homelessness research, and I applied for it, and went through the interview, and had a great interview with Bernie and Trudy, and told them that I was the right person for the job, and they had to hire me because I know what I'm doing. So they did. They hired me. We knew right then and there would be a great working relationship. I had all the control. So, no, it was good. I applied for the job, got the job, and then utilized my experiences of homelessness and connecting to community and who I knew and what I knew, and then proceeded to start working with Trudy on the issues of homelessness and what we needed to do to include people, and how, as Trudy said, how did that look for the community? And we didn't have a problem finding people that wanted to speak and wanted to talk and wanted to give their opinions, because the whole community has something to say. And to give them that moment was a fabulous thing for them to acknowledge and to let them speak and to hear what they're saying and to acknowledge it and to hopefully find solutions that will be manifested soon. Okay.
So primarily you and I facilitated the focus groups together. We united all of them together. Mm-hmm. Brady took part in some of them, and Dakota, our other researcher, she was part of them. Sometimes there was all 4 of us when we had a great big group. And we went through that whole process of gathering all the information and analyzing it, coding and analyzing it. And we took our preliminary findings to a group of people with experience of homelessness and said to them, does any of this ring true for you? You know, and they went, oh, yeah. And so that was really neat to hear that we were on the right track. And we were really coming out with things that people thought were important to say.
And we got diverse groups. We got Aboriginal, we got women, we got youth. The youth were really hard to get a hold of, though, because of the fact that they're kind of under the table, and there's no agencies that really have them. There, and we know where they are, and we know how to get a hold of them. So the youth is a really hard group to, and they're the ones that are falling and slipping under the cracks and dropping away.
Like those ones that you say hard to get the youth. I don't know. Did any of them did they access the youth services that exist?
They did. They do, and we did get a hold of some youth, and their stories, like everyone else's, they're sad, and it's really hard to be homeless and listen to stories about it, and try to not convince people, but try to let them know that what they're saying is really important, and that we're going to try to access and use it in a positive way. So we did get some use, but we did really, the demographics, we really tried to reach out to the whole homelessness community, not just pick on the group that you see in our place or something like that. You know, we're the Native Friendship Center and places like that.
So it was just a couple sort of, basic things people told us about themselves in terms of their age. You can see there's quite a, a fairly even split, between the sort of the 31 to 41 to 50, and then a smaller group in the 31 to 40. But that whole 31 to 60 group was most of the folks. We had 59% people who were Caucasian, and we did have a high number of people who identified as Aboriginal or Métis participating, and that's because we actively looked for people. Income source, all but one person had indicated they had an income source, but not all were traditional income sources. You see the group, there's 25% to do alternative work, and they often people did alternative work to supplement. That would be like binning. There was bottling, and there were a couple of people who did say that they engaged in sex work. But there's a lot of the binning and bottling. Length of time in Victoria is a question that a lot of time people in the public have a perception that people come from outside the area. But in this group, you see that 55% of this group of people had lived here for more than 10 years, which is a very long time. And it was only a tiny percent of people who had been here less than a year. So what did we learn from doing this? What did people have to say to us? Well, when we looked at all the data and we talked about, for some time, doing all the analysis, we came to two similar kinds of things. And one was what we call exclusionary forces, which were barriers in the lives of people that hamper their ability to participate, and inclusionary forces or factors that would help people take part. Exclusionary forces came to sort of under three main kinds of headings. Caught in the homelessness industry, people had a lot of very strong feelings about what we refer to as the homelessness industry. But there's a web of agencies that actually serve people who experience homelessness. And there's a very, very strong, I think is the most polite way I could say this, feelings that although there are some folks in agencies individuals who they really appreciate and who they can work with, there's a strong feeling that homelessness is institutionalized, and that many of the agencies are actually there for providing jobs, and that if it wasn't for them, then these agencies wouldn't exist. Homelessness is a full-time job. Whenever I have told this, and we've talked about a couple of times in public when we did the Café Scientifique, and a fellow came up to us after and said, I have absolutely no idea.
Can I interrupt your train of thought for a second? I don't know if it's about this institutional, because otherwise you'll probably forget it, I think, if I waited to the end. But you mentioned that it's a very strong feeling that homelessness is institutionalized and it's about providing jobs. Do you mean providing jobs for the individuals in the actual organization versus the homelessness people?
Yeah.
Oh, okay. Just wanted to clarify.
And that
so they pick up, your individual that's homeless would pick up that there's an inequality occurring. Okay.
Yes,
absolutely.
That was absolutely there.
Okay.
Many people's
So they sense
it.
Really well.
And that there was little sense to actually end homelessness, but that it was more about managing it. And that the homelessness is a full-time job. Now that is people have been quite shocked by that statement, and what that means is that for people who are homeless and who are in the downtown area, there's a whole web of services that people go to. So you're talking about services to have a place to sleep, talking about a shelter for sleeping, talking about a place to eat. You're talking about dealing with to get some health issues addressed. You're talking about dealing with the Ministry of Social Development for income or assistance, any kinds of assistance issues you have. For example, if you were staying at Rock Bay Landing, which is over in the Ellis Street area, and you're going to our place for a meal, that's a 2.4-kilometer walk.
And most they're walking everywhere.
And
They don't have bus tickets and don't have cab fare. They have to walk to all of the agencies.
And people are walking regardless of the weather.
Yeah.
Right? So they're going from A to B, and then there's times that, like for the Salvation Army provides a meal, that there's different meals at different churches, for example. But those times are set, and they have to be there at that time to get that meal. And that often, for example, there's a lineup for free meals. So if you go to our place, for example, for lunch, and you're staying at Rock Bay Landing, you need to get back there by 3 o'clock, I believe it is, in the afternoon. If you don't have a bed to line up, to get your name in line for a bed. And then you have a meal, and then if there's something else, then you can come all the way back again. So there's a lot of time and energy. And what they said was that their whole life, the whole day is taken up trying to get their basic survival needs met. And so, in fact, being homeless is a full-time job.
And the Native Friendship Center is out by Silicon Valley. So imagine that, like walking from downtown to get to the Native Friendship Center, and back downtown to get home.
And they don't get bus tickets.
And they don't get bus tickets.
And they don't get bus tickets. Okay. Stigma and discrimination that manifests as a lack of respect for people who experience homelessness. There's pervasive kinds of experience, many by people who identified it as Aboriginal. This is a fellow who, he said, I think it's really all of your energy trying to put food in your belly. By the end of the day, last thing you want to do is stand up at a 500 and fight that you, because they're physically and emotionally exhausted and often have more than one kind of illness. We're not just talking about a mental illness, having a mental illness or an addiction here, we're talking about lots of physical illnesses as well, from stress, from being outside, from being unhoused, from whole lots of things. And this was an Aboriginal woman, by blonde hair and blue eyes, and I was a white woman. Then you jump at it. And he goes, so this was her remark in regard to actually to an SNP officer.
Hey, just a quick question. I'm just wondering, the group here, if the homelessness industry, if we're all just, like I'm part of homeless industry, and I'm just wondering if everybody here is just the public that doesn't know all this stuff. Just like, okay.
Doesn't matter. You're presenting something, aren't we here? Because we're here, no?
Are you have concern? Do you feel offended in some way?
No, I just,
This is what people told us, right?
Okay.
Yeah.
Okay.
Some things people said were pretty hard, and there's a lot of crying. People are very hurt, and. So, in terms of the exclusionary forces, there's an overall and an overwhelming feeling of powerlessness. I think people didn't feel like they had any reasonable ability to give their feedback, and if they did, it wasn't paid attention to.
And I think part of the frustration with people giving their feedback, homeless people particularly, imagine yourself starving, hungry, frustrated, angry, fed up, and you have to talk to somebody about your needs. how well are you going to communicate what you need when you're really hungry and you're really tired? The staff members of agencies are just, and this, I'm really specifically in ministry, they have this idea that respect goes both ways. Well, it does. But when someone is really tired and frustrated and just fed up, it's really hard to talk properly. I mean, you know, we all have our moments where we've had enough and we don't speak properly. But with the homeless, they get treated really badly when they can't speak properly because they're tired and frustrated. And that's just not okay. Like, we have to have a little bit more compassion and empathy for when people are upset and angry and frustrated. And we have to listen to them a little better. And we need to focus the anger and energy and help them to instead of just whatever, brushing them off or saying, okay, well, you're angry and you're yelling at me, so I don't want to talk to you right now, and then you brush them off and you push them aside. Well, the needs are not getting met, and then they're going to get even angrier. So are they going to be any more communicative to people? Probably not.
And that's why participation, and that means taking part and giving feedback, becomes where the title came in, was taking a leap of faith. People have to risk one more time that giving an opinion might be useful, that there might be something come of what they've done, and do so in the face of an overwhelming feeling that it's not really worthwhile to do that, and also do so in the face of the possibility of a real cost to themselves in terms of their meeting their daily life needs, their survival needs of having enough to eat and a place to sleep. When we look at inclusionary force, so it's not all bad. It's not all down. People also had a lot of ideas. They came in anyway, and they told us, okay, you know, well, what would be really helpful here? What would work for you? So the inclusionary kinds of forces are earning respect, developing trust, and valuing experience, ideas, and feedback. So it's important that people talked about seeing someone as a person first, and someone who has homeless second, or has a mental illness or addiction second. Demonstrating respect through openness to listening and receiving feedback. Getting to know individuals as unique people with histories and with skills, with assets. And listening to and acknowledging suggestions and feedback. And explaining processes to people. People were really, it's like, don't just change a policy on us. Say so, say why. It's not that we would necessarily disagree, just tell us why. The things that many of us, that I would certainly take for granted in an interaction with an agency, with a service agency, that I would be, someone would greet me, with a, not necessarily a smile, but be willing to listen to what I had to say, would reflect back, would make some effort to try to address that. And if they can't, say why that would be and what might be different, and how negotiate what we can do. Right? One of the staff members brought you in and said, "Yeah, we looked at your suggestion. Here's what we think." So that mutual interaction just between two people. This is a person whose concern was, developing trust and relationships between staff. This big wall of staff, they've got a safe place to say. And I always felt there was a huge barrier, and people spoke many times of not feeling like they could approach people. They were sitting behind a big desk and they couldn't approach.
Is that about the street light? That's just out of curiosity, because I know street light was. That sounds like it's describing the street light. Do you remember?
I can't. Yeah. I can't.
Well, okay, yeah, obviously.
I felt there was a barrier, very little empathy. Quite often I didn't feel safe to express myself. It's more about the relational aspect of it, about that there was a physical barrier, but the physical barrier also created an emotional barrier. It's like crossing the Great Divide, and a lot of people identified with that. that the staff were sort of in their space, and they found it very, very difficult to approach them. Just back a sec here, that people really, they want to have their voices heard, because that's the thing we came up with a lot. People say, well, no one's listening to us. And they really want to be able to have their voices heard, but they want to have it mean something. They want to have some real effect on agencies and make things better for themselves as a direct response to the sense of disrespect and exclusion and discrimination that they felt. So we got the program part. So these are just some of the many ideas people offered us. And creating systemic change. People really had really good ideas about, they knew that several people spoke about the issues of the structural kinds of things, about lack of housing came up over and over and over again, about poor incomes that just people can't make it. They can't afford to pay for rent and food at the same time. They just can't do it. So they wanted to be able to tell their stories directly, to meet with the change makers. I think that the person who said, they said, mostly the people we need are, she said, the billboards for the organizations. They have no change-making ability. We need to talk to the people who do.
Or the people that are sitting at the front line desk at the ministry. They don't do anything. They just take the paperwork and shove you through to the next person. So they want to get to the change makers at the ministry, not just the frontline workers.
Folks want to be able to tell their stories and share their experience. I think that's one of the things that if you speak to what the coalition is doing in terms of the SIAC.
Social Inclusion Advisory Committee, which I'm part of also. I'm the support. What am I? I'm Social Inclusion Advisory Committee peer co-chair. That's what I am.
It's a heck of a name, yeah.
So we got a group of homeless people together, and we meet every once a month or so, once every 2 months, and we discuss issues that are happening. And it's a group inclusionary force. We're gonna create change somewhere, somehow. We're gonna do it.
And people take part, right? And they actually go out and do.
There's stipends, there's food.
You get training for 2 presentations.
Training for the Speakers Bureau, which I'm also a part of. The coalition is getting some groups together that are really coming together to include the homeless people to make changes around the community for them that will work for them. Is there a question?
No, you answered.
Okay.
And the last is we have several recommendations for the coalition around these issues. Was the creation of a kind of trust, and when people feel respected and valued is a precursor to participation. Developing a clear strategy for participation, partnership with people who have experienced homelessness, so that the coalition in using this information to support development of policy. People with experience of homelessness need to be at that table. Equalize power relations to create common ground for participation. And common ground is a lot of things, and that includes the very basics of having a decent room that's nice and warm, with comfortable places to sit, with decent food, with stipends, with a time that works for everybody, that doesn't interfere with the needs of the daily life. Support peer-run organizations of people experience to provide opportunities to have a concerted voice, but have that voice outside a funded agency.
And the common ground also means that the homeless get stipends and they get paid, because the people who are coming to those meetings who are part of organizations get paid to be there. So the homeless also have to get paid to be participate,
Yep.
because anybody else gets paid.
How would you, propose or dream about equalizing power relations?
That's a big question.
That's the biggest one of them all. Okay, Wayne, that was really good.
See you in 5.
Yeah. So the very beginning place of doing that is the thing about the stipends and the food,
Yeah.
and the bus tickets, and the childcare.
Living.
Because those kinds of things are already available by and large to most of the people who would attend any of those kinds of sessions. So what that does is, so that people who experience homelessness want to participate, but doing so cannot cost them.
So that equals the power.
So that's some ways of beginning to equalize those power relations. Very in the material sense of material needs, but very clear and specific. And lastly, that's somebody's got boom, boom on the table and said, you gotta make it feel like being there. It's gonna make a difference in your life. Because otherwise, why bother? References. Oh, there's the academic